Mrs. Mercy A. Asante. Ms. Asante, you're welcome to the one and only adults class.
Thank you very much.
Tell us about Evolution Healthcare Center.
Well, Evolution Healthcare Center is an alternative health center. We use homeopathic and herbal medicine alongside massage, physiotherapy, reflexology in treating. And so when you come, we don't usually look at a one-way treatment.
Okay.
If homeopathy, we use homeopathy. If it is herbal, if it is the two we are going to join, we join the two so that at least within the shortest possible time, no matter your condition, whether it's chronic or acute, we get it solved.
I think I need to fix myself inside there because of the reflexology part of it.
Part of it.
Yes,
Love
yes.
it.
Because yes, I learned a little of the reflexology massage.
Okay.
All right, but the thing is, we want to talk about. Tell us about
Infertility.
yeah, infertility.
Well, this
What is it?
since this one is an adult class, we are going to center more on couples, married couples.
yeah.
So when we say infertility, is the inability of couples, let me say man and woman, who have agreed to be together, having tried, having had sex persistently or continuously unprotected. That one is very important.
Yeah.
Unprotected for at least 1 year, and still it's not coming. They are not conceiving. That is what we say infertility, or when we say those couples are infertile, meaning they are not able to give birth, having tried having sex unprotectedly for at least 1 year.
Wow.
That is infertility.
So in such cases, what do you do?
In such cases, we look at your causes. You know, there are several causes of infertility in terms of men, in terms of women. But Africa, let me say, even generalize the whole world. When we say infertility, many people focus on the women. And we conclude that it's coming from the women.
Okay.
But it's not also.
Okay.
Sometimes, or let me say, from research, we can say that 33% is from men, 33% is from women, then the other is from unknown sources. That is what we have all agreed on.
Okay.
And so we can't just focus or always say that it is the women who are having the problem.
Okay.
Everybody may have problem relating to fertility.
Okay, so now let's sort of do the segregation.
Okay.
When it comes to the men, what are some of the common reasons why men would have what do you call it, problems with impregnating their wife?
Okay. Majority of the problem is either that they don't have sperm at all.
At all.
At all. Then that one, we say, it could be as, let me say, there could be some underlying factor to it. That one, medically, we say azoospermia.
Azoospermia.
Then we have some of them that are low in production. You know, as you started your program, you were mentioning the number of sperms you put out during even 1 sex. Yes.
Yeah.
So if you come and through investigations, we find out that yours is too lower than what we expect you to get, then that means you stand, let me say, some point of not being fertile. Then there are some who also have what we call varicocele. They have some veins around their testes being inflamed. And then when the inflammation comes, mostly it causes some kind of heat production, and so they can attack the sperms, either destroy their shape or, let me say, the sperms, and then they wouldn't be having, let me say, the quality sperm that we expect you to get. That one too is a factor. Others are some underlying. You have some risk factors that predisposes someone to have infertility. Some are infections. Some people are having chronic infections that, you know, mostly when organisms come into the system, they try to attack cells try to attack the blood, and so they're about like they will destroy your sperm cells automatically. So if you're having especially sexually transmitted diseases like the HIV, hepatitis, gonorrhea, the syphilis and DEMS, it becomes difficult for you to have a fertile, or let me say vital sperm. That one is there. Some too have hormonal imbalances. Some are having problem with circulation. You made mention of that one. If you have problem with your circulation, whether that you have maybe high blood pressure attacking your blood vessels, automatically, you know, for erection to take place is with your veins and arteries. So for blood to fill in at your genital area, it depends on your circulation. So if you have a poor circulation, then blood will not be able to fill in there, and then erection to take place. If erection is not taking place, automatically you can't have sex. So you end up being infertile.
So with men who also suffer from diabetes, would they also have problems with impregnating their wives?
Sure. You know, diabetes in general, it collapses mostly your nerves, it collapses your blood vessels. Okay. That is when we are talking about the blood vessel issue. So nerves in general, you know, nerves mostly work with the endocrine system in terms of hormones. So all of them will begin to either come lower or too high, interrupting some kind of hormones, and that will trigger. So
that will still keep your hormonal systems in balance.
Yes.
Okay. And once that imbalance is created, everything in your body doesn't work well. Yes. I think that was what I was talking about.
You were talking about.
I'm a doctor.
Okay. Then stress too is a factor.
Yeah.
Now everybody is focusing on money. We don't really have time to sleep well, enough time to rest the body. When you become so stressed and you become so tired, automatically, in fact, you can't even go 2 or let me say 2 minutes. But you may not even ejaculate. You can have the sex, but ejaculation might not take place. That one too is a factor. Then we have the one that cannot be explained in terms of the men. But then in women, there are many. You know, women.
But let's look at that one again. Would desperation in both men and women to have a child also affect them not having a child?
Seriously. So mostly those people having infertility, is always advisable for doctors, or let me say practitioners, to also focus on the attacking depression side. Yes. At least if you don't talk about their mental health, they wouldn't understand the reason as to why hormonal imbalances even comes in. They will end up, a woman will end up stressing herself so much, and then sleep becomes
problem.
Estrogen levels goes down, and then when estrogen levels go down, automatically you might not even have your menses. You cannot even ovulate. So where is the egg? Fertilization can't take place, even if the man is so good in terms of the sperm. So depression, we have to attack that one. It's also a major risk factor to infertility.
Okay. I also read somewhere that anger can also do it.
All of them that attacks the brain. Because the brain is a mainstream of our system.
The biggest sex organ.
Yes. It controls almost all our senses. And so if the brain is not stable, if it is not in a good shape, automatically you are sick. You know our definition of health. Mental, physical, all of them comes in. So someone will be there and be like, oh, I'm not sick, and so I wouldn't go to hospital.
That is what the men do when they are not having children. They always
I'm
push it on the
always
women.
having problem with men in terms of those conditions. I had one patient who thought he had no problem, and they've been fighting this infertility for more than 10 good years. I started even giving him medication, and then it was later he came back and like, now my erections are even becoming
better. I
went through some tests for him, and
no sperm.
you see, he had to go back home and apologize to
the wife. Yes.
You see the damage they cause women.
So the men, the fact that you can fire doesn't mean you can give birth to. You have to really take care of yourself. There are other things you need, and that is what she's talking about here. So tell us. Let's shift to the women. So what are some of the causes?
Okay, with the women, we are always having bigger issues, but it's not really so big that if we're able to attack it at the right time or as immediate as we see it, things will be better. We have infections, the STIs and them coming in. That one too, they can cause ulcerations, they can cause tuber blockage, they can cause so many things with our lower abdominal organs, in terms of our ovaries, our fallopian tubes, the cervix, the womb, all of them.
Those are the real female sexual organs, not the vagina. But I read the vagina is just a canal, just carries it through. Yes, but
it's just the mouth.
Yes.
So infection is number one.
Apart
from infection, I talked of in men imbalances of hormones. Women have that problem really much, especially in Ghana. Majority of infertility cases, a side infection, is hormonal imbalance. Some people, as we were talking about, have so much stress going up and down, and so for them to ovulate, because estrogen levels becomes down, and then the progesterones that is supposed to be limited in women starts to shoot up. And so automatically either they are menstruating, but it wouldn't really come well. Some also have problem with, they are able to ovulate all right, but the egg is not even able to reach the womb.
The womb. All the way around, it's not able to come.
It ceases because maybe they have problem with their tubes.
Okay.
Some of them are from trauma. It could be a fall or rape or whatever. Some also have it with infection. When you have infection, automatically you get some fluid occupying your. Then ovarian cysts, or let me say polycyst. That one too is a major case.
Okay.
Is a major case. We treat that one at evolution speed.
That's nice.
That one too, it's also really disturbs fertility issues. We have endometriosis, that is the thickening or the growth of tissue around the of the womb. That one too really disturbs women. That comes with that painful. So you see, menses is normal to experience the pains, but it shouldn't be too much. So when it's too much, then automatically we say that you have a problem there. It could be endometriosis, it could be fibroid. So fibroid, I've mentioned, fibroid too is one. It could be that, you know, the fibroids, the location also matters.
Yeah, it depends on where it's growing up.
So if yours is just at the cervix, meaning that for the semen to pass, it becomes difficult. And so as you have sex, you have the semen withdrawing.
Okay.
Let me say semen again, because people still think what they see is sperm. The sperm is what we can see. That is inside the semen. So let's all understand it and say it that way. Semen. So it makes the semen.
But for the students of the adults class, they know that because we show it here.
Yes,
for the students of adults class, those who watch adults class, we do that. So you know there's the difference between the semen and the sperm.
Okay. So that one is there. Apart from that, those who have ever had surgeries.
You will want to include abortions.
Yes, abortions there. That one, don't even go there.
It's a problem.
A lecturer of mine will say, if you have even attempted only one, you stand a higher risk of getting infertility issue.
All right. Let me activate the phone lines at this point. So, if you're watching and you would want to call into the show, the lines are open. The contacts are on there. just call in and let's have some interactions. It's been really wonderful having Mrs. Mercy Asante here. Your final words for couple.
My final words.
Yeah, those couple want to have children.
Especially Christians, let me say believers. They don't really know the time they should have sex so that fertility will be okay. They have not even bothered to ask their women when they are having ovulation.
Do they even know the women themselves?
Most women don't even know.
Yeah, they don't even know.
That's why you have to ask. You go to your doctors, you go to health center, ask so that we help. Some people think having sex is just having sex.
All right. Do you have a caller from Tema? Hello, caller.
Hello, good evening.
Yeah, good evening. Your name and where you're calling from?
My name is Gift. I'm calling from Tema.
Okay, Gift, let's hear you.
Yeah. Please, I want to. Yeah, hello.
Lower the volume of a TV set, please. Lower the volume of your TV set so we can hear you. Lower the volume of your TV so we can hear you.
Hello? Yes.
Hello.
Okay. Please, yeah. I think I can speak to you.
Yeah, speak to you.
Okay. Matt.
Okay. When you call, please lower the volume of a TV set. Hello, caller. Hello, caller. Yes, you were talking about. Okay, hello, caller.
Hello, no, good evening.
Yes, good evening.
Good evening, no.
Yes,
Good evening.
Your name and where you're calling from?
My name is Pastor Frank Chris.
You're first saying.
Oh,
We lost Chrissy. That is too bad.
Okay.
Yes, you were saying.
We made mention.
Okay, we have a caller on the line. Hello.
My name is
Reduce the volume of your TV set and call. Or if you hello, caller.
Yes. Hello?
Yes, your name and where you're calling from.
Yeah.
Your name, please.
I produced it.
Okay, let's hear you.
I'm just calling from
Kumasi, all right.
Yeah. I'm Joseph.
Joseph, yes, let's hear you.
Yeah. Please, I have this issue. There is this girlfriend of mine. Almost all the time, I always feel I haven't touched her, but she's not always trying to agree. Because of something that she's very kind of how do you call it?
You say anytime you want to have sex with her, she doesn't want to agree.
Yeah.
And what is her reason? She's hepatitis B. And she doesn't want you to become infected.
Yes, please.
And then you want to become infected.
But she's your wife, or let me say she's my girlfriend, so...
Your wife or your girlfriend? So why won't you let her finish treating, right?
Yes.
She has to finish. She has to treat it. It is not an incurable disease, right? You can treat it.
It is cured.
Yes, you can cure it.
So should I stay away from that?
Let her have treatment, because if you go and have sex with her now, the likelihood of you being infected is also there.
You know, you should know that the lady loves you. Any woman who is able to tell you that this is what I have, I don't want you to experience same, should tell you that the lady loves you.
Okay.
So there is vaccine for hepatitis. So you can have a vaccine. Go to health center, any health center in Kumasi. Ask for hepatitis vaccine.
All right. You have another caller on the line. Hello. Hello, caller. Hello. Hello.
Okay.
Yeah.
So you can have a vaccine. It's not too costly.
Yeah.
And
it's
even
not.
if it is,
You have to.
you just
Okay.
have to.
All right. Hello. Hello, caller.
Yeah, hello.
Your name and where you're calling from? You're calling from Kumasi. Oh, network. Yeah, so
Please.
yes, the lines are actually jammed because everyone is calling into the show. So you keep trying, you get through. We have another caller on the line. Hello, caller.
Yeah, hello.
Yes, your name and where you're calling from?
My name is Anthony and I'm calling from Kasua.
Anthony, can you please speak up?
Yeah, I say I'm Anthony and I'm calling from Kasua.
Okay, let's hear you.
Please, I'm having this expression like, with my lady, I have an affair with her the last time and then as now like my feelings inside is stinging and I don't know what to do.
Your penis inside is burning you or paining you?
But it's somehow.
I didn't hear that part of it. The last part. What did you say? Itching.
Yeah.
Okay.
Yeah.
So, Miss Mensah?
Yeah.
Asante, Miss Asante, yes.
Kaswa to Kaneshi is very near. You can come to Evolution Healthcare Center. We'll give you treatment. But before the treatment, we have to investigate what is causing it. But the best way is to come with your partner.
So both of you can treat.
Both.
All right.
We search conditions. We can't.
All right.
One
We have another caller from Ashaman, Lebanon. Hello, Becky. Hello. Hello, Becky. Yes. Let's hear you. Becky, let's hear you.
I wanted to ask the doctor on the show that I've not been menstruating for some like 2 to 3 months now. I don't know the problem.
But the thing is, have you had sex with any man?
Yes, I'm married.
You're having sex with a man?
I'm married.
You are married. And have you done any test, like a pregnancy test or anything?
Yes, I have.
And it is negative?
It's negative, but I'm not menstruating either.
All right, so...
Okay. You see, we were mentioning hormonal imbalances, infections. And so please, you can come so that we investigate into your condition, whether yours is as a result of hormonal imbalances. We have medications we can give you that it will flow.
Okay.
If yours is related to just advice or
also
that depression kind of a hand, then we have to go in there.
All right, we have another caller from La Paz. Becky, hello. Hello, Becky.
Unknown caller.
Hello, caller. Hello. Hello, caller.
Yeah, hello. My name is Dennis.
Your name is?
My name is Dennis. I want to contribute to the program.
All right, let's hear you, Dennis.
Okay. Hello?
Yeah, let's hear you.
Okay. I'm with my fiancée.
Dennis, where are you calling from?
I'm calling from Amahia.
Amahia, okay. That is in my neighborhood. Adenta municipality.
Yes.
All right, let's hear you.
I'm my fiancée, and for about 4 months now, we've been trying to conceive, have a child. And anytime I have sex with her, the sperms will come back whenever she gets up.
That is a problem.
Yeah, that's my problem.
Okay.
You see, sometimes we don't really know the quantity of semen you have ejaculated.
Yes.
So you can't say that it is all that comes out. But there are some conditions also that causes such to happen.
Such stuff, okay.
So
like a shifted uterus.
Yes.
All right, so hello, we have another caller on the line. Hello, caller.
Yeah, good evening.
Yeah, good evening. Your name and where you're calling from?
My name is Maria. I'm calling from Klagon.
Klagon, that's nice.
Klagon, yeah.
Yeah, Klagon, yes.
Yeah.
I hope you've been watching adults class, or is your first time?
Yes. No, I've been watching. Actually.
Oh, you're a student. All right. Yeah. You have to bring your school fees. All right, let's hear you.
All right.
Let's hear you. Yeah.
Okay.
Let's hear you.
You have a problem. My often vaginal discharge.
You have a vaginal discharge.
Yeah, I have this discharge. and anytime I keep treating it, it keeps coming back.
Okay, so
It
Doc,
keeps
if you can,
coming back.
Mercy, if you can pick,
Right.
if you can pick the notes so that we can answer them. All right. So vaginal discharges. All you need is evolution. Just contact evolution. You get you. All right. So John from Medina. Hello. Hello. Hello, John.
Yeah.
Yeah, John. Let's hear you.
Okay. Yeah. Hello. Yes.
Yes.
Good evening.
Good evening.
Yeah. Hello. Good evening.
Yeah. Good evening. We can hear you.
Yeah. Okay. Yeah. Thank you. I wanted to find out from the doctor if
there's no doctor here. We are all not addressing ourselves as doctors. Even though we have knowledge, we're not calling ourselves doctors. We don't want any trouble. Yeah, so let's hear you. Talk.
Okay. I think I was speaking to the radio. I was a TV station.
Adult class, yes. Let's hear you.
Okay.
Yeah.
That is okay. Thank you.
Okay.
Thank you. Yeah, what I wanted to find out, I wanted to know if consistent practice of masturbation can also lead to infertility.
Okay. Masturbation continuously.
Yeah.
Now, you see, if you are a student of adult class, you will not masturbate. You will not masturbate simply because I've taught this here. Your body produces 2 million sperms a day, and you are training 200 million. As you continue to produce, you mess up your testicles. You become infertile.
That's all.
It's as simple as that.
Yeah, you're triggering.
We have another call on the line. Yes, so far from Ashiaman, let's hear you.
Oh, okay. Please, I just want to find out. Anytime I have sex with my husband, it's as if I get some infection. I don't know. And some time ago, I used this family planning IUD, non-hormonal.
Okay.
Yes. And I don't know if that's what is causing it. It's affecting my menstrual cycle, comes to pain and everything. I've had 2 children, but still, it's giving me problems. So I don't know if maybe the infection comes to my husband or maybe it's the IUD.
You see, the fact is, you are treating, right?
Yes.
But your husband is not treating.
That is the main issue. That's the main issue. Many people have problem with that. Reinfection will come in, and so definitely you wouldn't have any effect of.
All right, we have Matilda from Burma Camp. Matilda from Burma Camp, hello.
Yeah, hello.
Yes, let's hear you.
I have this issue. I have a problem with my lower abdomen. I do feel pain.
When you have sex?
Yes.
Or when you are not having sex, they are 2 different things.
When I don't have sex, I do feel pain. But when I have sex, I do feel pain.
Okay.
I've been married, and then I'm having issues with
fertility,
with giving birth.
Okay. Yours could be PID, pelvic inflammatory disease. It could be that you have problem with your bladder. It could be that you have cysts. Mostly young, let me say adults, they have cysts so much. That one gives you pains, especially in terms of ovulating.
Okay.
Whenever you ovulate or you are menstruating,
you're
experiencing. So you have to come.
Okay. All right. So you can contact Evolution. Someone from Kaswa, hello.
Hello, sir.
Yes. Let's hear you.
Yeah. My wife is pregnant. I want to find out. My wife is pregnant. And she always menstruates every month.
She's what?
She always menstruates every month.
She's pregnant and still menstruates. Yeah.
Yes.
But has she done any tests to see whether she's lost the pregnancy or she still has it? Because it is normal. Hold on, it is normal for a woman to have a pregnancy and then bleed once in a while.
Yes.
But
so if there's any,
well, I think what he has to do is do a scan.
A scan. Then the person, she has to also go through HS.
Okay.
To check her hormones.
All right. So we have Frederick from Lakeside. Hello, Frederick. Hello. Yeah.
So let's.
Frederick. Yes. Hello.
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 Yes. Your name and where you're calling from?
My name is Louis, calling from. Hello.
Yes, we're hearing you. You're calling from where?
Adenta.
Adenta. Okay. Let's hear you. What do you have to say?
Please, my wife, anytime I have a she said she's not feeling it, or she doesn't feel anything.
She doesn't feel anything. Frigid.
Yes.
Okay. Okay. Just bring her to the adults class censored, okay? So you pick this number 050 131 131 8160. Yeah. Okay.
We have medication for that. Low libido.
Okay, so we have Rashid from Alajo.
We have Rashid sitting here.
Rashid from Alajo. All right, Rashid from Alajo. All right, hello, caller. Hello. 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 The lines are jammed, so it's a little difficult. Yes, we have another caller on the line. Hello, caller. Hello.
Hello.
Your name and where you're calling from? Hello.
I think we lost him.
All the lines are jammed. Hello, we have another caller on the line. Hello. Hello, caller.
Hello.
Hello, yes. Your name and where you're calling from?
I'm calling from.
Please speak up so we can hear you. The network is bad. We can't hear what you're saying. All right, we have another caller on the line. Please call back, okay? Hello, caller. Hello.
I called earlier on my any response. I'm calling back.
Okay, so let's hear you.
I called. I think I'm from Becky. I'm Becky. I'm from Lebanon. Sorry.
Okay, all right. Let's hear you.
And I'm saying my menses have not been flowing for some time now.
Mm-hmm.
Yeah,
and what?
I think she called earlier.
Mm-hmm.
She said she didn't get an answer to her.
Okay. We'll answer it. Okay, we'll answer it.
Do you remember the question?
Yeah, say her message is not coming. So we have Isaac from Ashaman. Hello. Hello, Isaac. Hello, Isaac. Hello.
Hello.
Yes, hello. Mary. Mary, okay. We mommy mimbo botwe. Oh, mamprobi agege. Hey, first and my chase or girl kuyaje. You first and my chase or girl kuyaje. We mommy botwe, don't mind me.
Oh, fine. Oh, fine.
You more. Mini, if you bring me, you more.
You. Oh, fine. You go to the minute. If you're not champagne,
Ona sharp pain.
Yes.
Okay. No problem, Ona.
Oh, fine.
Okay. No about Fiji. Okay, Nina. Okay, Doctor Nama Bahabu. Ona. Mrs. Messi Asante, alternative doctor. Okay, no about for line or what? Come on, cook Okonoma ni Okalawi. Allo ya a clinic here, Kanishin. Near Crabble. Onu. All right. All right. Okay, well, another call on the line. Francis from Dansoman. Francis, let's hear you, Francis.
Yeah,
hello.
Okay, please.
Yeah.
Please, my question is this.
Okay.
What are of a topic? Yes, please. Okay, thank you. My question is this. What are... Hello, I'm hearing you clear.
Yeah, talk. Let's...
What
Turn the television off so you can hear us.
What are the causes of ectopic pregnancy?
The causes of ectopic. You see, if you want to talk about the causes of ectopic, you will not leave here. All right, so you pick Mr. Sante's contact, and then you would... All right. Hello, caller.
Hello.
Yes. Your name and where you're calling from?
I'm calling from Alaji. I'm Rashid.
Rashid, okay. Yeah, let's hear you, Rashid.
I want to know, when you are sexually addicted and you don't also want to throw your sperm away, I want to know if there is something you can do.
Like you are sexually addicted?
Yeah.
Why should you become an addict of sex? That's the first thing. Why do you want to become an addict? Why do you want to become an addict, and with how many sexual partners?
No, when sometimes you always want to have sex, but you know it's not good for you. So
that is exactly what you are doing on the Adult Class Censored show. Just register and come and join us. We'll show you that. All right, so you have Otukpo for Madam. Hello.
Hello, good evening.
Good evening. Your name, is it Otukpo? Otuko. Okay.
Yes.
All right, let's hear you.
Please, I also have pains anytime I'm having sex with my husband.
You see? Okay, that is the problem, right?
Yes.
There are two things. It can either be an infection or probably the man is too big. Too long.
Yes.
Unknown caller.
Right? Because if it is longer, if the man is a little long and he is hitting your uterus, it will hurt.
Yes. Sometimes it could be fibroid.
Yes. Okay. All right. Wisdom from Akachi. Hello. Okay, Wisdom will be our last caller. Hello, Wisdom.
Hello.
Yes.
Good evening.
Good evening.
It seems like I have a problem that has to do with free ejaculation, but not in terms of having sex. I'm a student.
Okay.
So during our exams, like if the time limit is mentioned.
Okay. Okay. We didn't hear you, Anna. Yeah, I mean, if it is premature ejaculation, Sam, you are a young man, right? And you said you are in school, right? Just take your time, hold on to whatever problems you are facing. Finish school. You don't like me for what I'm saying, get married. And then come to me, I'll show you how to stop it.
I think he should rather check
whether he has
if it's infection.
Yeah.
Other than that, he is going to stay in school and it will turn into chronic.
That is if he's already having sex. Yeah.
So you have to check if you have any infection. If you are not having infection but it's due to other factors, then you stay away from sex till you complete school. All right.
So Mrs. Messi Asante, what is the A for?
Abrafi.
Abrafi.
Yes.
Okay, Abrafi Koto. Put your contact out so that when people want to reach you, they can be able to reach you.
Yeah. Okay. 0555
0555 20
52
35. The number again.
0555 20 52 35. Yes. Okay. If you are around Pokuase, Amasaman, we have one branch over there at Ga Odumase Top Radio. Ga Odumase Top Radio. Kaneshi, we are at Malam Station, very near Metro Mass.
Okay.
Metro Mass, not the Impampum one. Metro Mass, right after the small bridge.
Okay. Yes. All right. So you can see Mr. Sante's contact on the screen as well. So it's right under here. You can pick it and call her for whatever questions or whatever needs you want.
Yes.
All right.
We are
so
on Facebook,
On Facebook.
Yes. Evolution Healthcare Center.
Evolution Healthcare Center.
Instagram. Evo GH. Evocare.
Evocare GH.
Evocare. EVOCARE.
Okay.
GH.
Okay. All right. Siciano, we are finished with you, but I'm shy. I'm going to do sex positions. I'm shy of you, so I would want you to just leave our set. I'm not sucking you. All right. I am told that I should. No. She's going to put pressure on me. Don't mind me. All right. So what we are going to do is we're going to go for a short break. When we come back, we'll do just a couple of our sex positions, and then we'll attempt to read some text messages as well. Yeah. So stick and stay with us. We'll be back after the short break.
Jenny, if you are going to announce, I'm offended enough. As I shepa, and I are a papa, Miji Free Evolution Healthcare Center. Kaneshi, Oba, who how they saying, Aya Kukramuyare, Aya Depua, Aya Fibroid, and our war to Tumrika Bra Evolution Healthcare Center. Kaneshi, answer me a better. You know about 2 years so, near Mount, no other quality or Yari. Now what's in your swollen new muscle? And now who me? Bema you dawati na so ntimi nkyere obobre ana wo so doing some brains yare oho me doctor mama tia say emoto ene ma yare di enya tutu me kabra Evolution Healthcare Center kaneshi na beji wa yare sabo papa
so oba Evolution Healthcare Center ye was scanning machine ultra modern one ye de hwehwe ni pedua ni honam apa ahodo no boni be ka say organs